Let's turn to the medical side of this. There's a variant spreading in India. What do we know about this variant? How concerned should we in the United States be about it?
Well, we don't know a lot about the variant. We don't know a lot about what the impact of this variant is because there's not a lot of the genetic sequencing that we talk about. So we know that people develop COVID, but they don't know what specific variant of the virus is causing their illness because they're not sequencing enough. What we do know about this variant is that a type of it has been seen in South Africa, a type of it has been seen in California, so it's not just relegated to India. It's probably already spread around the world and now being picked up in various places. It's also becoming increasingly clear from Dr. Fauci and others that the vaccines that we're talking about do seem to be protective against this variant, whether you're here in the United States getting a vaccine or anywhere else. Obviously, the problem there is that not enough people have that sort of immunity yet.
Now I'm joining you from Batra Hospital, a very sharp contrast to what you just saw on the streets of Delhi. This is a sophisticated first world institution, some 500 beds, and it has been absolutely hammered. Just today, they lost 8 people due to lack of oxygen in the space of a few hours. And I'm joined by the director of the hospital, Dr. Gupta. Doctor, how do you cope, and how on earth did this occur?
It's the most unfortunate situation today because of a lack of oxygen. You are losing about 12 patients. The number is increasing. You are seeing them every day in the morning and suddenly you see that he is no more. The person whom you could have saved, the person you could have treated, and suddenly because of no oxygen, somebody is dying. This is absolutely not digestible.
Not digestible, and you lost a colleague today.
Yes. At the same time today, one of very senior person of my hospital, Dr. R.K. Himtani, who is the head of the Department of Gastroenterology. We lost such a wonderful person and who was a real Corona warrior. For the last 1 year, continuously, he is fighting for Corona patients. He got Corona. He was admitted in ICU. One of my colleagues was saying that I was talking to him, and in front of me, he collapsed.
And these patients have all died today in the space of a few hours, I understand, because you even you issued an appeal for oxygen and it just didn't come.
This is what's happening for the last 1 week continuously and regularly. We are not getting the adequate supply of the oxygen in my hospital, and not my hospital only. Most of the big hospitals in Delhi, they are not adequately supplied by oxygen. What a hospital wants from the Delhi government, they want oxygen.
Buddhist monks in Sri Lanka pray for divine help to stop a deadly wave of the coronavirus that is sweeping across India.
Buddhist monks and Buddhist people in this country want to share our sympathy with the people of India.
India is grappling with the world's worst COVID-19 outbreak, with record numbers of infections and deaths, and the crisis has spilled across the border into Nepal, where the capital is now under a 2-week lockdown. Officials say the rate of infections there has increased beyond the control of the health systems in several districts, most of which are near the border of India. Before the restrictions went in effect, people crowded bus stations to get out of the city.
There is fear of coronavirus. We may die of coronavirus if we stay here, so we are going back to our villages.
In Sri Lanka, more than 100 areas across the country are under lockdown because of a jump of infections in April. Schools are closed, and employers are being asked to limit the number of people reporting to work. The Philippines is extending its lockdown in many cities until mid-May. Last week, the country surpassed 1 million confirmed cases, stretching hospital resources, especially in the country's capital, where the outbreak is at its worst.
Beds, we don't have enough beds they're all full already.
Thailand is converting a check-in terminal in its main airport into a vaccination center.
The airport has a lot of space, and the team has managed good social distancing.
Bangkok recently closed public parks, gyms, and daycare centers until May the 9th and introduced fines of up to $640 for not wearing a mask in public. Pakistan is cutting 80% of incoming international flights in the next few weeks to try to curb the number of cases there. The military also stepping in to patrol the streets in cities like Lahore to enforce mask wearing and to make sure shops close at 6 p.m. Countries across the region taking measures to contain the spread of the virus, but it may not be enough for some places. Singapore announced it is tightening its entry restrictions, closing its borders to visitors from Bangladesh, Nepal, Pakistan, and Sri Lanka. Christy Lustout, CNN, Hong Kong.